I'm Melissa Atkins. I'm the CEO of UofL Health Mary and Elizabeth Hospital, and I will tell you this has been 4 years in the making. And to say it's a labor of love is an understatement. It really is. So we're really excited to be bringing this back. It's a $20 million project. We do want to recognize, too, that $8.25 million from Metro Council as well, and really excited about that. That grant, along with a significant investment by UofL Health, so we cannot leave them out, allows us to renovate nearly 21,000 square feet of space. In fact, where you're standing right now is going to be one of the rooms. You know, our expectant families will find 8 labor and delivery, recovery, and postpartum suites, and they are suites, as you can see. Tom, when he first saw it, he goes, "Those are huge." And I said, "They are," and that's the whole point. We want people to want to come here, and we want to give people in South, Southwest, and West Louisville a great place to come and deliver their children and to make memories. The birthing center will also include a C-section suite. It'll also have another one that will be shelled out for growth, and I do think we're going to grow quicker than we think, so that's exciting. We got a Well Baby Level 1 nursery, so we're going to have that as well because we're partnering with our downtown facility with Dr. Francis and his team. Antepartum exam suite, centralized nurses station, family lounge, which I think is going to be very important. So it's going to be a family affair, whether you want to go for midwifery or you want traditional OB-GYN care. We're going to do it both. We're going to do it all. But of course, we're going to have those beautiful suites for every one of them. So, and we've got the labor lounge. It provides a calming, soothing environment for laboring mothers, education classrooms, consult places, an updated lobby, a cafe space, because of course, if you're here to deliver, you want coffee. So, right? The families need some coffee. So, and the last time a baby was born here was 1974. And not to give away my age, but I was a year old. So, yeah. My birthday is Monday, by the way. Yeah. 50 years old. I know. So now through your leadership, generosity, and support, more families in our area will be able to deliver their newborns close to home, which is very important, with exceptional care. I do want to give a very special shout out to Councilwoman Cindy Fowler. Without him, we would not be able to do this. Thank you. She got behind it from the very beginning, and she never stopped, and so thank you. Aaliyah Fox, I do want to thank her as well. She is our Vice President of Philanthropy. She was right there with us. Thank you, Aaliyah. So, over the coming months, the hospital will start to evolve, and we look forward to, again, welcoming expecting families, babies, fathers, grandparents, you name it, they're all going to be here. And we're excited to bring the new life, no pun intended, to Mary and Elizabeth Hospital. So we're looking at it probably being in 2025. So we're hoping it's going to be sooner, but we don't want to give a timeline that we can't meet. So I'd also like to give credit to Tom Miller. He is as I said, our fearless leader, our CEO of UofL Health, the entire system. Thank you, Tom, because we did get 11.75 from UofL Health. Tom's vision for UofL Health really strengthens all of our communities by investing in each facility, and this is proof that he does that. So people can get medical care they need close to home. We all know people want care in their own communities, and Tom Miller is supporting all of us in making that happen. Tom, thank you. I'd like to invite you up to share your thoughts.
Thank you, Melissa. I hope the first thing you notice is her energy and passion for this hospital and this community, because it is infectious. And when she said, let's invest $20 million in a women's service, I'm thinking, there's not a hospital in the country that's adding women's services anymore because of so many difficult things. But I just want to say thank you for your passion. I want to thank Marianne. Thank you for what you've done associated with it. And Representative Fowler, thank you. Your dedication is what's made this. But as we look at this hospital, and you know, we acquired the hospital in 2019, and I would call it barely a community hospital because some more people were leaving this community than getting care here. Melissa's first goal was, we're going to be the community hospital for this community here. And I think we are doing that. And I look at over the years the things that have happened. You know, when you look at the medical detox program to helping those who have such difficult issues, when you look at the Brown Cancer Center that's now on this campus and what it's going to do, when you look at cardiac services and opening a second lab and offering STEMI services so those ambulances don't have to go downtown. When you look at the family practice residency, and I have to point out John Becker and the chair of family medicine and Marianne Mallory and Dr. Francis, our partnership with the university has helped making us be more successful. So thank you for that. But the ability to bring that whole residency program here and let it be based at this hospital just offers amazing services. Additional ORs that we're adding, and now $20 million for the women's services. We are truly trying to make sure this hospital meets the needs of this community, and that is what our goal is, and just would say thank you. And the goal that Melissa has is to be best in class for women's services, not just a typical OB unit, but to offer all services to all of those patients in need. And I appreciate that. I will never fully understand that, but we're fortunate that for this zip code, we truly are trying to build the birthing place. And it joins the Center of Women's Services that's already on this campus. And having this as convenient for the community, the thought that 150 years old next year, and this is the first time in 50 years there's going to be an elective delivery west of 65. Those are amazing things for this community. And it doesn't matter what your resources are or what zip code you live in. There is truly a right to great health care, and that's what I think we're trying to do. And I think it's both a win for the babies and the mothers in this community, so I look forward to that. Melissa already mentioned this couldn't take place without the support of Councilwoman Fowler and so many others. But somebody else I want to recognize and ask to come up is the mayor of our great city, who truly, during some of the difficult times that we've had lately, whether it's been shootings or whether it's been other violence that have happened, our mayor is there trying to say, how can we make a difference? We appreciate your support for the health of this community. Without you, we couldn't make this happen. Thank you, Mayor. Please come on up.
Good afternoon, and thank you, Tom. Thank you, Melissa, for your leadership of UofL Health. What you all are doing here and throughout our entire city is amazing. It is truly saving lives every day. It is making people healthier, and we are so fortunate to have you all and all of your colleagues, doctors, nurses, the rest of your medical staff, and the entire team at UofL Health just makes Louisville a better city. So thank you all so much. I'm going to start by continuing the train that you all started, and that is to thank Councilwoman Fowler. If I remember back a couple years ago when I first reached out to Councilwoman Fowler and told her I was thinking about running for mayor, we had a conversation. And in that first short conversation, she talked about her vision and dream for this project and why it was important. I then followed that up with a tour of her district, again, long before I was mayor. And I would say a good portion of that car ride around her district was focused on the medical needs of South Louisville and why this project was so important. So thank you, Cindy, for your leadership, and thank you to council members Rick Blackwell, Jennifer Chappell, Betsy Rui, and all of your other colleagues for making this project a reality. Your leadership on this is going to truly impact so many lives in our city for the better, and thank you all very much. So, yes. And Lieutenant Governor Coleman, thank you so much for being here and for your and Governor Beshear's leadership throughout the entire Commonwealth and your focus on health care. Being here today sends a powerful symbol of how important this project is for this part of our city and for this entire Commonwealth to continue to invest in providing quality and accessible health care for everyone. Regardless of gender, regardless of circumstances, we in Louisville and the Commonwealth of Kentucky want to provide great health care to you. And Lieutenant Governor, you and the governor have really been leading that charge. It is so wonderful to be here on behalf of Louisville Metro government to celebrate the construction of the birthing place. This is, as I've already mentioned, is such an important and necessary project that will continue the legacy of care at this facility that goes back all the way to 1874. It's amazing. A legacy that, as Tom referenced, includes leadership by UofL Health through some challenging times in our city, whether it's as a result of gun violence or whether it's through a pandemic like COVID. Every day, you all are saving lives and helping get people help who need it the most. And so for those reasons and many more, with Councilwoman Fowler's leadership, this was such an easy decision, I think, for so many people involved in Metro government, because this is an investment in families, in children, in the future of our city, and in particular, the future of South Louisville and West Louisville, two parts of our city that have been overlooked for far too long when it comes to medical services and so many other things. But today, we are saying that is changing. And this $20 million investment, led by, in part, Metro government with the $8.5 million investment, is just part of that declaration that things are changing. Because everyone deserves access to affordable, quality health care. As the governor and lieutenant governor often remind us, it is a basic human right for everyone, particularly here in Kentucky and in Louisville. And there is no form of health care more fundamental than care provided to new and pregnant mothers and children who are just coming into this world. What happens during a pregnancy and during a child's first few days on earth can affect their entire lives. But there's so much more help that is needed beyond that. And so I'm grateful not just for this partnership that we're announcing today, but for the robust and growing partnership involving the city and UofL and UofL Health and the Commonwealth of Kentucky as we think about other things that we can do to provide more high-quality, accessible medical care to people living in South Louisville and in West Louisville. So I'm excited about celebrating today, but I'm even more excited about the conversations that are happening now about what we can continue to do to build on this great project. And this is so wonderful because it's focused on helping pregnant mothers and children in their first years. But let's also build on this momentum and think about the child's first years of life, not just their first days, as we're doing here. Let's use this momentum to think about what universal pre-K could do for the kids, yes, for kids that are born in this facility, to then continue to support them in their earliest years and make universal pre-K a reality. Let's do that at the state level. Let's do that at the city level. Let's continue partnering with great partners like UofL Health to make every child, every adult, everyone in Louisville have the opportunity to live a safe, healthy, and strong life. Congratulations. Thank you all very much.
Mayor Greenberg, thank you very much for your support. And I don't know, all of you know, he is leading a tremendous effort in regard to economic development and how we grow this community to be a vibrant community. So appreciate your leadership associated with that. As we look at the investment in the birthplace, you also have to look at where the state has been in helping us. And I look around our organization and that we opened Fraser Brownsboro, and I appreciate Lieutenant Governor Coleman, you being there as we're opening up this March. South Hospital in Bullitt County bringing new services to the rural community that's there, and as we're expanding University Hospital to open up those beds for all those patients who aren't getting beds every night in our organization. It takes the support of everyone to really make a difference in healthcare, and we do appreciate you. As I had the opportunity to introduce Lieutenant Governor Coleman, there's a unique fact. As we know today, and I don't know all of history, you are the first lieutenant governor to welcome a newborn while in office. And just, when you think of firsthand experience, you have that. And your support of education, your support of the health community, and the administration's support. I know there are those who believe that COVID didn't exist. I will assure you it did exist. And we got through this in this state because of the support of our governor and lieutenant governor. They have been so present at everything we've done. Team Kentucky did make a difference. I just want to say thank you on behalf of the whole community for what you do. Let me invite you to come up.
Thank you so much, Tom. And you're right, I am the highest elected woman in Kentucky to give birth while in office. So to being here with you today, it was really important to me, both personally and professionally. I am happy to report that I am one and done. But Representative Rachel Works has pledged her firstborn to this hospital. So there's that. So I want to say a special thank you to all of the doctors and the nurses and the custodial staff and the people that keep the train on the tracks every single day. I think back to the challenges we've all been through together, whether it's the COVID vaccine or whatever other challenges that have been out there. You have answered the call when people needed you, when your community needed you, and you deserve the title of healthcare heroes. And I hope you know how much Governor Beshear and I endlessly just support and admire and are grateful for the sacrifice that you make every single day for this community. And today we get to celebrate that labor and delivery services are coming to South Louisville for the first time in 50 years. And I know, Tom, you and UofL Health, as well as Louisville Metro, have been here every step of the way to make this a reality. And again, I'm going to echo everyone else and recognize Councilwoman Cindy Fowler, who was the muscle behind this, quite frankly. So thank you for seeing this through. I think about as we talk about economic development, as we talk about the possibility of tomorrow, the opportunities that we are building in Kentucky, none of those are for us. They are for the next generation of Kentuckians. And so every announcement that we get to make about record economic development investments, $26 billion in Kentucky under Governor Beshear's leadership, 50,000 new jobs all across Kentucky, number 2 in economic development in this country, number 3 in rural job creation in this country. And I think about the promise that we are leaving the young people who will be born in this hospital, to know that we're building a better Kentucky for them, and to be reminded of why that is so critically important as they get the best start that they can in the first days of their lives. And to know that these kids won't have to leave home to find opportunity and jobs and careers that they long for. It'll be right here in their backyard when they are ready for it. And so we're going to keep investing in our communities, from healthcare to education to job creation, every step of the way. And I don't want us to lose sight of this. I don't know if you all know this, but there is an election going on. If you happen to see that. We'll all be glad when those commercials are over, please, believe me. But let me just say this. Nothing that we're talking about today has anything to do with politics. There is nothing red or blue or D or R that has anything to do with making sure that we put people over politics, especially at this juncture of someone's life. And so I just want to say that Governor Beshear and I will continue to do what we've always done, which is to put people over politics and to keep investing in these critical areas where there is such a great need. And if we do it right, we can take the last 3 years of progress and turn it into 30 years of prosperity. And so congratulations to UofL Health, Mary and Elizabeth Hospital. I cannot wait to come back when we open the center. Thank you so much.
I do also want to recognize some other leaders here, and I hope I don't leave anyone out. But we do have, Miss Dory Shelburne. She is the CEO of South Hospital, the soon-to-be South. So she is here recognizing and supporting what's going on here. Thank you, Dory. And with Bullitt County. So, and I've got Andrea Lewis too. She is doing important work as the CEO of Peace Hospital. Thank you, Andrea, for coming out to support us as well. And an interesting note about the 3 leaders, including myself, that I mentioned, and the one thing that I said to Andrea when she first got her role, I said, guess what? I go, you know what the 3 of us have in common? And she goes, we're women? I go, no, although we are. But we're nurses. We're all nurses. And so I think, so if anyone wants to know the why, Tom knows that's the why, because you never can lose a nurse's heart. I'm just saying, we got to take care of our entire community. Also, I would like to thank all of the people at Mary and Elizabeth Hospital. I don't want to leave anyone out. We have so many wonderful leaders here who do their jobs every day. They did it during COVID. They never lost a beat, and that's across all of the healthcare system as well, and all the staff. And I don't want to call out any specific staff because they're all equally important. And so, thank you. All right, so I would like to welcome Councilwoman Cindy Fowler.
I don't know if I'm going to get through this without crying. I am so excited. This is a day of celebration for all women west of I-65. For the first time in almost 50 years, we're going to be able to birth babies west of I-65. I mean, it's amazing. And it's astounding to me to know that that is even a reality here. But my husband and I were both born here at this hospital, and I know that many of you were as well if you grew up in this area. But I am very proud to have championed this cause. This was near and dear to my heart, and I really am thrilled that this is going to be a reality for the women of west of I-65. I mean, South Louisville, West Louisville, Southwest Louisville. I'd like to thank Mary and Elizabeth for your vision, especially Melissa, and all that you have done to champion this. It's just refreshing to know that there's somebody that have got women in mind, and it's important for the women of this area. I want to also thank my colleagues on the council that supported the funding, especially President Winkler, who listened to me crying at him and said yes. So it's so important that we thank UofL, thank Metro Council, and thank the women of this community and congratulate them for what is coming. Thank you.
Now I would like to introduce someone else who was very important in getting this through as well and very supportive. He is our Chair of Women's Services at UofL, Dr. Sean Francis.
I'm not ashamed to tell you guys that it is pretty intimidating to follow a cast of professional speakers. I am not a professional speaker, and I'm going to try to get through this. Maternal care is a core health care service. And right now, in Louisville, these services are concentrated in East Jefferson County and downtown. South Louisville community deserves to have a women's health care program closer to home, and today we're one step closer. Mary and Elizabeth Hospital serves the zip codes with the highest birth rates, and we're proud to bring maternal services back in nearly 50 years. I just wanted to comment, if you guys want to see somebody really perform, watch Dr. Fowler do her thing. I mean, Mrs. Fowler, I'm sorry, Congresswoman Fowler do her thing, sorry. She's impressive. She's crying now, but I've seen the other side of her, and she really gets some jobs done. Maternal mortality rates are rising in the United States, and this disproportionately affects Black women and women of lower income. 60% of these deaths are preventable. We expect the birthing place to provide a much-needed resource for women in this community. We also expect it to positively affect Kentucky's maternal mortality by offering increased access and alternative options to traditional hospital labor and deliveries. Through the care of midwives and bringing on a personalized program grounded in evidence and delivered with compassion. If we do need more care, there is a NICU right down the road with our specialists who are maternal fetal medicine doctors, and we have links to get us right there. There will be 3 academic physicians, 24 residents within the University of Louisville School of Medicine Family Practice, thanks to Dr. Becker, and they will provide all of the care that all the babies will need, again, with the access to the medical center down the street if they need to. Finally, today you'll hear Melissa Atkins give credit to everyone else, including myself, but I want you to understand that this center is a product of her determined efforts achieving what some of us thought was impossible. I also want to thank and share with you that our leadership, including Tom Miller, Dean Bumpus, and Dean Gansel before him, have performed like I've seen no other leadership in the last couple of years. And if what they've done is any indication of what's to come, then this birthing center is just the beginning of great things for Kentucky. Thanks.
I will tell you, once again, that brought me to tears. It did. Yours did too. I mean, Tom Miller told me if we made this happen, we'd be changing the landscape of families in this area. And we are. And I think that's so important. And Tom knows, hey, I'm a fighter. I fight for what I want. And, even though I was told it may be a long shot, we got it. Took us a while, though. It took us a little bit, but we got it. It's just perseverance, but it's with a wonderful team. So thank you. And the partnership with our UofL physicians is such a benefit to the community as well. They've really added a lot of different service lines, and I don't know if you've ever seen any of our strategies, but they're pretty robust. And we continue to make them robust because we want to continue to add. Tom Miller told me when I got here that he wanted me to restore this hospital to a full-service community hospital and only send downtown what we have to send downtown, because he wanted to bring care back to the communities. And thank you, Tom, for doing that. And once again, I know we've mentioned quite a bit, but it's so important that we were able to get the $8.25 million from Metro Council and the city's support. And I will tell you, it was voted in 23-2, so I'm proud of that. But we also want to make sure future generations also recognize the support. And by doing that, I'm going to ask Tom to come up and our chairwoman, Marianne Butler, I want them to help unveil the commemorative plaque that we're going to put on the birthing place.